Thank you, Stephanie. We're going to call this meeting to order, everyone. Good morning. Good morning, everyone. This is a policy, wait, which one am I in?
Is that reach?
Too many.
Mini
Outreach and
meeting.
engagement. Too many Zooms. My goodness. Outreach and engagement for paid leave. Welcome, everyone. We're going to call this meeting to order. Stephanie, if you can start us off with roll call, please.
Yes, thank you. And just for the record, I'd like to note it's 9:02. Ava Bermuda Zimmerman,
Present.
Isha Canada has not joined us yet. Adrian Cochran will not be joining us today. Sheila Hummel,
Present, good morning.
good morning, thank you. Molly Weston Williamson will not be joining us today. And Justin Zartman,
Present.
thank you. We do not have a quorum.
Thank you, Stephanie. Since we do not have a quorum, we're going to skip right now the meeting minutes, and then we're going to go right into legislative updates.
Actually, Isha is just coming in now, so we could
Oh,
hold
perfect.
that
Okay.
thought. Welcome, Isha.
Good morning. Apologies, I'm in the car this morning.
No worries, but with you, we now have a quorum, so we can go back to the minutes.
Perfect.
Awesome. So we're going to be reviewing the minutes. May I have a motion to approve the minutes from last month's meeting, or technically the March 20th meeting?
This is
I'll give a
just
motion.
so moved.
Do I have a second?
I'll second.
Thank you, Isha. All in favor, say aye.
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 Yes. Thank you. Minutes approved. Thank you then. Let's move over to legislative updates.
Okay, great. Good morning, everyone. Just have a quick legislative update for you all this morning.
We
Okay,
can see
sorry.
your screen.
Okay, great. Thanks, Steph. Okay, so a little less than 3 weeks are left in the 2025 legislative session, so we're really approaching the end. We continue to follow Senate Bill 1427, a bill that came from the Labor Committee co-chairs. You might remember that Aaron testified in support of the bill in March. And then since then, we've really continued to provide, different information and support on the bill when necessary. The bill covers public and private elementary and secondary school employees under Connecticut paid leave and Connecticut FMLA, if their position does not require a certification or a license. This would include paraeducators, cafeteria workers, bus drivers, library aides, and other groups of workers. It does not include public school teachers. The bill passed the Senate last week with an amendment that clarifies the definition of a public school and allows the authority to create a policy for determining the base period and base weekly earnings for school employees. That just takes into account that school employees may opt to be paid a little bit differently than other workers, and we just wanted to make sure that there's a level playing field for them when we determine their eligibility and their benefit rates. Now we're waiting on next steps for the bill, and in addition to Senate Bill 1427, we also continue to monitor other pieces of legislation that could either impact our outreach work or just our overall operations. We're also keeping an eye on different amendments, especially as we head towards the end of session. I also have just a few additional updates. First, we were excited to co-author an op-ed recently with Governor Lamont and DACD Commissioner O'Keefe that highlighted Wallet Hub's recent study that ranked Connecticut as the second best state for working moms. Our op-ed was published in Hearst media outlets over Mother's Day weekend, so that was really great. I also just have another quick update on our legislator newsletter. Again, we send this monthly, and it includes different updates about our program, links to recent media, and also our Google map that shows the number of claims by town. We continue to see a really high open rate on each month's newsletter. In March and April, we saw a 95% open rate, which is high. May's newsletter was sent earlier this week, just on Tuesday, so we don't have really a accurate update about what that rate would be for this month. Yeah, we're just kind of waiting and seeing what the trends are and ways to really improve not only our open rate, but also making sure that people are reading through the content as well. Lastly, I just wanted to share that we'll be at the Capitol on Tuesday next week for Representative Kai Belton's third annual Mental Health and Wellness Fair. Representative Belton is also a guest on an upcoming podcast episode, which I'm sure Nancy will share. And we're really excited to continue our partnership with her, support her work, and also talk to legislators and community members about our program at the Capitol. So that's it on my end. So
Thank you, Maddie. That was great. And I want to say that you underplayed the open rate by saying that's good, with not reinforcing that it's fantastic. It's like an amazing open rate. 95.8, 95.2 is amazing. So keep up the good work. That means the content that you're providing is necessary, right, for legislators to understand what's going on. So thank you. We'll move it along now with Jessica with outreach and engagement updates.
Thank you. Good morning, everyone. All right, so
we can see your screen.
thank you, Ava. As always, wanted to just start with our upcoming events, recent and upcoming, I should say. So we were at the WBDC Women Owned Business Day up at the Capitol last week. Today, Nancy is heading down to Bridgeport for the Southern Connecticut Black Chamber of Commerce Network Connect and Build Together Business to Business Expo at Housatonic Community College. And then this weekend, we'll have representation at the New Haven Family Stroll and Festival. Thank you, Ava, for sending that suggestion our way. As you heard from Maddie, we will be participating in Rep. Belton's Mental Health and Wellness Fair in Hartford next week. And on the same day, we'll also be at the Access Health Small Business Summit in Rocky Hill. And then later on this month, the Latinas Empower Symposium in Hartford. And thank you again, Ava, for sending that our way. Then as we move into June, we will be at Make the Roads 3rd Annual Community Health Fair in Bridgeport. And actually, somehow it escaped my list, but on June 10th, Make the Road also has a community health fair in Hartford. So we'll be at both of those. New for us this year in Pride Month in June, the Glastonbury Pride Festival on June 8th. The Triangle Center Pride in the Park in Norwalk, which we've done the past couple of years and is always a great turnout and great opportunity for us to connect with the community in Fairfield County, and West Hartford Pride. So we are getting into our really busy season. We'll be out and about, and if we happen to be in your neck of the woods, we would love for you to stop by and say hi to us. Wanted to just talk about something we've been discussing in our outreach team meetings is a renewed and sort of refreshed focus on healthcare providers. So what we're working on is a couple of different materials and resources to help healthcare providers with their part of the paid leave process. So a toolkit specifically for those in the healthcare field. Also a job aid to help when they're filling out the certification of a serious health condition form, just with some sort of tips and tricks and ways we can make sure that we're getting the proper and necessary information the first time to just try to reduce that, back and forth of the applicant having to go back to their healthcare provider and ask for revisions. We've also been talking about some more targeted outreach to professional health organizations. And Maddie in particular, I just wanted to thank, she's been doing a great job sourcing not only these organizations, but also some specific events that they have coming up in the fall that we are exploring our tabling and presentation opportunities. Some of those include the Connecticut Psychological Association Conference, which is in October, the Connecticut chapter of the American Physical Therapy Association Conference, also in October, and the Connecticut APRN's Symposium in November. So as we complete those materials, we will share them with you. And just keep you up to date on this outreach. Another project that we've been working on is the Contact Us form on our website. So wanted to really shout out Virginia, who did a very thorough, comprehensive analysis on the Contact Us cases coming in the first quarter of this year, which was a tremendous amount of work. And she did a really great job kind of breaking down what reasons people are selecting when they fill out those forms, and then what kind of information they're truly looking for. And so, based on that analysis and just kind of anecdotally what we hear, we know there's a need to revamp the Contact Us page. When we started out, we weren't doing benefits administration yet. And so, we know that we've added a lot of things over the years, but haven't really taken a holistic look at that page and how we can make it more user-friendly. So we have a working group with representatives from all the different teams within the authority, and we have just started having some meetings to talk about how we can really streamline that page. We are going to move towards a role-based system. So instead of just a big pick list of items, it will be, you know, kind of tell us who you are, and then based on who you are, here are some of the different, you know, reasons to select for your contact inquiry. So this is really kind of phase one. And then after that, we are really going to look at redesigning the entire Contact Us page to just try to encourage more self-help. We know we have, you know, tons of information out on the website. So figure out ways we can get people to hopefully find the information they need before they go to that Contact Us form. So this is not just an outreach project, really a whole authority project, but we will keep you informed as we move through and make those updates. And then lastly, I just wanted to give a quick update on the Community Education Coordinators Initiative. Virginia continues to do a really fantastic job, not only with just keeping, you know, these folks on track, but also providing support to them. So the first quarter obviously just ended recently, and their first quarter reports were due at the end of April. So Virginia's been working on compiling the feedback and data, and just have a couple of high-level highlights to share with you. First, I just wanted to share this quote up at the top of the slide from an applicant who received some direct application assistance from one of our CECs, the Center for Latino Progress. And I think it just really illustrates that this is doing what we hoped it would do. It's giving people who need a little bit extra assistance to either understand the process or get that application in. It's giving them a trusted, familiar face in their community to help them. So I was just really excited to see that feedback. So in terms of the summary for the first quarter of the year, the 7 CECs attended, or I'll say attended in-person events, gave presentations, workshops, visited local businesses a total of 85 times. They provided assistance to 48 individuals, which was 35 over the phone and 9 in person. Not all of these were necessarily application assistance. Some were just folks who needed a little bit more information and wanted to speak to somebody about it. So really great to see that it's already been a pretty significant number just in the first 3 months of this program. And really, this was honestly more February, March, because January is when we did our in-person training and kind of wrapped everything up. So they really didn't hit the streets until February. What's coming next is that Virginia is planning site visits where she and I will go to either the CEC's location or at an event they're going to be at or a presentation they're giving, just to observe and to provide some feedback, and also just perform a general, you know, face-to-face check-in on how things are going for them, what needs they might have, and how we can continue to support them. And then just some additional efforts that have come out of this program. Erin appeared on one of our CEC's radio shows up in the Willimantic area in April. The organizations have told us that they are making some slight modifications to some of our outreach materials just to make them, you know, really better reflect their communities and the way their communities receive information best. And they're doing a ton of sharing through social media and newsletters, just as other ways to get our information out there into the world. So that is my update for this 2-month period, and I'm happy to answer any questions or hear any feedback.
I don't see any hands up. Thank you, Jessica. Just to clarify for our audience, anyone listening in, CEC is Community Engagement Centers, right?
Community Education Coordinators.
Oh, so CEC and the acronym is the same CEC acronym on that was on your slides.
Yes.
The side one. Okay.
Yeah, sorry about that. It's a mouthful, so we tend to just condense it internally, but I should have used the full name.
Okay. Thank you. Any questions for Jessica? I don't see any. Okay, I guess we're gonna move right along to any old business.
Sorry, Ava, just if I could turn it over to Nancy for a moment just to provide the podcast
Oh,
update.
absolutely. Of course. Go ahead, Nancy.
I'm just going to share my screen. Thank you. if we can- Can you see the screen?
Yes, we can.
Okay, great. Um,
Nancy, if you, oh, perfect.
there we go. So we're looking at May and June guests and topics. So in May, we've already released the podcast about Autoimmune Arthritis Day, and May 12th was Fibromyalgia International Awareness Day. And my guest was Melissa Marquis. She's a nurse and she wrote a book. She's an author, and her book really helps people navigate an autoimmune disease in the medical community. It took her 13 years to get a diagnosis, and she's a nurse. And so she really talks about how many doctors she had to go see, how all of her autoimmune diseases, the symptoms kind of changed. So it was a really long process for her. The next one that is up is with Representative Kai Belton. It's Maternal Mental Health Month. It's Mental Health, oops, I spelled that wrong, sorry, Awareness Month. Representative Kai Belton really gets very personal, and she talks about the birth of her child and how she was not heard by the doctors. And she was younger when she had her child. So she talks about that process. And she also tells us why she's the chair of the Black Maternal and Infant Health Caucus. We talk a little bit about that, a little bit about her political career and how she got in. And that is going to be coming up later this month. As we move to June, it is National Migraine and Headache Awareness Month. And I spoke to Gretchen Michelson. She is the founder and CEO of the Headache Care Center in South Windsor. And she is an expert. I got a real education about the different types of headaches, all the different types of migraines, and how they can be chronic health conditions and how Connecticut paid leave can really help. It's also in June, National PTSD Awareness Month. And my guest is Jyothi Vyalakara. She's the founder of the New England Psychological and Neuropsychological Associates in Rocky Hill. She also works as a psychiatrist for Demas. And so we're going to be doing this podcast on the 30th of May. And we're going to be talking about trauma and PTSD from diagnosis to treatment and how long that takes. And I'm hoping to get another guest on as well to talk a little bit about PTSD and trauma and all that entails and how Connecticut paid leave can help in that instance. For fun, I just want to look at the countries and territories that we are in. I'm really excited that Finland's on there and France. So it's the top 10 countries are really fun to look at, that we even have people who listen to the podcast. And the top 10 in Connecticut, or the top 10 cities, Bristol, and then it's New York, then West Hartford, Farmington, New Haven, Bridgeport, Windsor. There we are in Germany, and then Ashburn, Virginia. So I always find that very interesting about how many people listen and where they listen. We have 7,462 downloads so far, 969 downloads in the last 90 days. And you can always find the Paid Leave podcast on our website, on our YouTube channel, and all the platforms that you may find podcasts, like Apple or Spotify or whatever you like to listen to. The way we grow this is just like and subscribe, and thank you for your support and sharing with your friends and family and coworkers if you can. And stop sharing.
Thank you, Nancy. That was great. Keep up the great work. Very exciting to see our upticks in Germany. I think we're always eager to hear that.
I don't know why. I really don't.
Curious.
I love it though.
It just highlights that the content that you're providing and the speakers resonate internationally, and the content, I'm looking forward to hear some of the autoimmune disease. It's always good to learn something that you don't know, and even though we're doing it within the context of paid leave, it's information that people might not know or might be helpful to their own lives. So it's great.
And she was really amazing. It's really a harrowing story for her as a nurse and not getting the medical attention. And it took 13 years for her to get a diagnosis. Go Yale.
Wow.
That was who found it for her. Thank you so much for that.
Thank you, Nancy. Any questions for Nancy? Any comments for Nancy? Okay, I don't see any, so I'll go right along back to old business. Any old business? Okay, any new business? Don't see anyone. Okay, thank you. Do I have a motion to adjourn?
Motion to adjourn.
second,
Thank you. Any discussion? And a second?
second.
Thank you. All in favor, say aye.
Aye.
Okay. Officially, we are adjourned. Thank you, everyone. Keep up the good work, team, and to the next outreach and engagement. Take care, everyone.
Thank
Thanks,
you.
everyone.
Bye.
Thank
Bye-bye.
you.